Today, we will be covering a basic Medicare 101, discussing how Medicare works, what options beneficiaries have, and the various enrollment periods. Everyone has unique doctors, prescriptions, financial and medical needs that make selecting the correct plan a very specialized process. You deserve a plan that has been matched to your unique needs, and I am happy to provide that service at no cost year-round. I am licensed and certified by the state and insurance carriers to represent Medicare health plans. Every year, I spend countless hours obtaining product-specific certifications from each Medicare carrier in order to remain independent and knowledgeable about both Medicare and all the different plan options out there. I represent Medicare Advisors Group, and I am able to contract and certify with most major Medicare Advantage, prescription drug, and Medicare supplement insurance plans available. Together, we promise to offer an unbiased opinion while educating you on all available plan options. I will teach you the ins and outs of your existing or new plan and always make sure your specific doctors and prescriptions are covered. I will conduct an annual benefit review for you and can assist you in applying for low-income support if needed. My essential role is to help you navigate through Medicare's many options and annual changes at no cost to you. Enough about me. Let's talk Medicare basics. Let's start with, when are you eligible for Medicare? You are eligible to join Medicare when you are 65 years old or you are under 65 and qualify because of a disability or another special situation. You must also be a U.S. citizen or legal resident who has lived in the U.S. for at least 5 consecutive years. A little more detail on the age 65 rule. All applicants must be 65. Your spouse's age does not count, and whether or not you collect Social Security does not affect your eligibility. Medicare has a lot of options for those who qualify, so let's try to make it simpler. Original Medicare is comprised of both Medical Part A and Part B. Part A is inpatient or hospital coverage, and Part B is outpatient or medical coverage. You will see these letters with effective dates listed on the bottom right of your Medicare card, and together they make up Original Medicare. When you have Original Medicare, you ultimately have 3 choices. 1, you can do nothing and simply use Original Medicare for health coverage. Original Medicare on average provides an 80-20 split of covered expenses, where the patient is responsible for 20% of the costs, and there is no annual cap on costs or prescription coverage. A standalone prescription drug plan, Part D of Medicare, could be purchased to help with the cost of prescription drugs. 2, you can select a Medicare Advantage plan, Part C of Medicare. Medicare Advantage plans are run by Medicare-approved private insurance companies that follow rules set by Medicare. They include all the benefits and services covered under Part A and Part B, and their goal is to help manage or coordinate your health care. Some Medicare Advantage plans usually include prescription drug coverage as part of the plan and create a maximum out-of-pocket for costs you can pay in 1 year. Some Medicare Advantage plans also include extra benefits you don't get from Original Medicare, like wellness programs, routine hearing, vision, and dental coverage. Lastly, you can select a Medicare supplement insurance plan along with a prescription drug plan. Medicare supplement insurance plans, or sometimes called Medigap plans, are sold by private companies and help pay some of the healthcare costs that Original Medicare doesn't cover, like co-payments, co-insurance, and deductibles. Medicare supplement insurance plans have a monthly premium that varies by plan, age, and location, and allow members to see any Medicare-appointed doctor or facility in the U.S. Medicare supplement insurance plans only supplement Original Medicare, which does not cover prescriptions, so those wanting prescription coverage will need to purchase a standalone prescription drug plan in addition. I realize all these different options and the endless acronyms or terms can be confusing. I am happy to cover all of them with you one-on-one, but for now, I will touch on a few key ones. HMO. HMO stands for Health Maintenance Organization, commonly seen in Medicare Advantage plans. This is where the patient must select an in-network primary care physician, or PCP. This primary doctor is charged with coordinating the patient's care and must be seen first for all healthcare needs except in an emergency. If a specialist is necessary, the primary doctor will refer the patient to an in-network specialist. PPO. PPO stands for Preferred Provider Organization. In this plan type, patients do not have to select a primary care doctor and can self-refer to a specialist if they deem it necessary. PPOs have both in-network and out-of-network options. Although patients can choose to go directly to anyone they would like, out-of-network options typically have significantly higher costs associated. SNP. SNP stands for Special Needs Plan. These are types of Medicare Advantage plans specially designed for specific needs. For example, dual-eligible plans are designed for those on both Medicaid and Medicare. Chronic condition plans are designed for those with specific conditions like diabetes or COPD. Institutional plans are designed for those living in a nursing home. Prescription drug coverage, or Part D, is one of the most confusing aspects of Medicare. Whether you received coverage through a Medicare Advantage plan or standalone prescription drug plan, the rules and structure are the same per Medicare stipulations. To begin with, all plans must establish a formulary and drug tiers. A formulary is the list of prescription drugs covered by an insurance plan. These drugs are then placed into tiers, and each tier has a specific cost. Medicare provides guidelines about the type of drugs to be covered on the formulary, but not the specific drugs. There are 4 annual stages to Medicare prescription drug coverage, but it is important to note everyone will not reach each stage. Stage 1, deductible. The amount you pay for prescriptions before the plan pays anything and moves to Stage 2. Stage 2, initial coverage. The co-pays or co-insurance you pay for specific prescriptions as outlined by the plan. This stage has a coverage limit that changes annually. If you reach that limit by adding up both what you have spent and the plan has spent on prescriptions, you enter Stage 3. Stage 3, coverage gap or donut hole. In this stage, the member is typically responsible for a higher portion of the prescription cost until they reach Stage 4 thresholds. Stage 4, catastrophic coverage, is the final coverage stage, and here prescription costs to the member are significantly reduced. The catastrophic threshold changes annually and is reached by adding up both what you have spent and the plan has spent on prescriptions. This is called true out-of-pocket costs, or TROOP. I know this is a lot to take in all at once, but it's very important to be aware of Medicare's many rules and annual changes. Plans can dramatically change from one year to the next, and you need to know your rights, or you may get locked into your current plan. Elections periods are a big part of Medicare and important to know, so we will cover a few before we wrap up for today. Initial election period is the 7-month window you get to select any plan guaranteed issue when you first come onto Medicare. This is the 3 months before your birthday, month of, and up to 3 months after. Annual election period, or AEP, is October 15th through December 7th each year, and is the time to review any plan changes for the following year and decide if you want to change plans effective January 1st. Medicare Advantage open enrollment period is January 1st through March 31st. During this time, if you are enrolled in a Medicare Advantage plan, you can switch to another Medicare Advantage plan. You may also disenroll from a Medicare Advantage plan and return to Original Medicare. You'll also be able to join a Medicare prescription drug plan. Special Election Period, or SEPs, allow those who qualify to change plans throughout the year. There are a number of ways to qualify for a SEP, but a few of the most common reasons are you retired or lost employer coverage, you moved out of your current plan's services area, or you qualified for state assistance. This concludes our quick Medicare 101 today. But by no means have we covered all aspects of Medicare. My goal was to give you a basic understanding of how Medicare works and what your options are. It is important to sit down with a licensed broker every year to compare plans and ensure you are on the plan which best suits your individual needs. If you'd like more information or to schedule your personal consultation, please fill out the contact form on this site and we will be in touch shortly. I want to thank you for attending today and look forward to helping you soon.